Yeah. If anybody has letters for correction, let me know. Yeah. If you have letters for correction, please let me know. Yeah, now we are correcting Hifza Jailani's letter. Yeah. So writing task. Miss Abigail Devon. L should be straight like this. Occupational. Here L is fine. Here L is not okay. Occupational therapist. Home occupational therapy services. 71 West Avenue. 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 Melbourne, Victoria. 3011. July 2019. Dear Miss Devon, regarding Mr. Peter Hendrick, comma, date of birth, 21 May 1972. 21 May 1972. Yeah. Mr. Hendrick, comma, should put a comma here. Mr. Hendrick, comma, who was diagnosed with myocardial infarction. F is looking like P. Infarction is being referred, spelling mistake. RE single F double R. RE RRED. Referred to your facility for ongoing assessment and appropriate management. Ongoing assessment. Work assessment, driving and normal activities, suggestions, education, review driving and normal daily activities. Yeah. Is being referred for what? Is being referred for is being referred for review driving and normal daily activities. To visit Mr. Hendrick, home visits. Home visits. Require is being referred for home visits. Is it a referral letter? Yeah. Is being referred for home visits. For assessing. Okay. Requires home visits. For advice. Okay. For assessment and advice. Okay. For assessment, not ongoing. Assessment. Home visits for assessment and appropriate management. Providing advice on returning to work, driving and normal daily activities. And reviewing the progress, you can say. It's not appropriate management exactly. Okay. Home visits for assessing the present condition and reviewing the progress. Right. Home visits for assessing the condition. Home visits, you can say, for assessing the condition and providing education regarding regular daily activities, normal daily activities, providing education regarding regular daily activities. Okay. Providing education regarding, okay. And even workplace assessment, return to work. Provide advice on returning to work. So workplace assessment also you can say. For assessing the condition, whether it is suitable for workplace or not, providing education regarding regular daily activities. So you can say three different things. First thing is for assessing the present condition, assessing the medical condition. This is one. Then you can also write about advice regarding workplace, providing, okay, providing workplace assessment Okay, when he can return to work, or providing counseling um, for uh, performing household activities or regular physical activities. Daily household activities. Regular daily household activities or whatever. Um, so these are some points which you can include here and remove this one. Upon admission, comma, intermittent discomfort, discomfort in the jaw. The jaw, which jaw? Lower jaw or upper jaw? Brought in by ambulance. To our history, discomfort in jaw. Which jaw is not given? He was brought in by ambulance. You could have written that, no? He was brought in by ambulance with a 2-hour history of intermittent discomfort in the jaw. Upon admission, no? Yeah, he was brought in by ambulance. Emergency basis, he came. That you could have written, no? Okay, he was brought in by ambulance. Or he got an emergency admission. Okay. Okay. I was admitted to the emergency department with with intermittent discomfort in the jaw. So discomfort in the jaw. That is not, so it's short. You have to write and expand. Here, experienced X is not clear for the last 24 hours. So like that you can say. Yeah. So this is one you could have used. But okay, no problem. Upon admission, intermittent discomfort in the jaw for the past 2 hours was being experienced. Was reported, was notified. Okay, was being experienced for the last 2 hours. So then upon admission you are telling, ne? Upon admission he told you, maybe. Otherwise you have to say for the last 2 hours intermittent discomfort in the jaw was experienced, was being experienced. Okay. He was admitted on an emergency basis with the intermittent discomfort in the jaw for the last 2 hours. Like that also you can say. In addition, heaviness in both the forearms. Both the forearms and 2 times it is written. And constant discomfort on the chest. Body parts always you have to use the. On the chest were reported. On the chest were reported. Heaviness, both the forearms and constant discomfort. 2 things were reported. Okay, here reported. Here were notified, we'll write then. Okay. Intravenous line was inserted in ambulance and initial management of symptoms was done, was performed or was done. Is this necessary? Is that all necessary? Hmm? Is this much necessary, I am asking. So brought in by ambulance, just all these things. Occupational therapist, what is related that you write? No? Hmm? Okay. And initial management of symptoms was done. ECG is showing ST elevation, ST capital letter. ST elevation. He has a past history of mild asthma, mild osteoarthritis, and dyslipidemia. During admission, emergency explanatory. During admission past was performed. ECG is showing ejection fraction 35% and ST segment, capital letters. And is showing ejection fraction and elevation of ST segment. Okay. ST segment is elevated otherwise. So you can say ECG is showing ejection fraction and elevated ST segment. This elevated ST segment. And elevated ST segment. And elevated ST segment. FBS, lipids, diabetes, protein, troponin, and complete blood count was performed. FBS, lipids, diabetes, protein, troponin, and complete blood count was performed. Currently, patient cardiac status, the patient's apostrophe S. Patient's cardiac status is stable, but why capital letter? But no need capital letter, right? Education regarding re-event is highly suggested. But education regarding re-event is highly suggested or recommended. Relevant lifestyle modification to prevent lifestyle modifications to prevent risk factors. Okay. Relevant lifestyle modification one to prevent risk factors has been advised. That's fine. But here it's better to put lifestyle modifications. It will not be one many. So here you can say have been advised. Low cholesterol levels and weight loss. Low cholesterol levels and weight loss is highly recommended. Weight loss is highly recommended. Weight reduction, not weight loss. Weight reduction is highly recommended. He also needs participation in cardiac exercise program. He also needs participation in cardiac exercise program. Atorvastatin, spelling mistake. Ator was statin. ATOR, not RO. Atorvastatin 40 mg once a day. Metoprolol 23.75 mg. What is this 23.75 mg? Once a day. 23.75 mg. mg once daily. Cleazipril 0.5 mg once daily. Aspirin. OD, don't write OD. It's once daily. Once daily. And thrice and trisagralar 90 mg once a day are advised. Why so many medications are advised? Discharge medications. The discharge medications include, you can say, all are important. Refraining from driving is suggested for 6 weeks. Refraining from driving for 6 weeks is suggested. For 6 weeks is suggested. That's better. Providing appropriate occupational therapist assessment for return to work would be extremely EXTTREML. Why double T? Spelling mistake, beneficial. Where is the closing sentence? In case any additional information is deemed extremely relevant, please do not hesitate to contact me. Then, yours sincerely. Yeah. Yours sincerely. After that, leave 2 lines. Leave 2 lines here. Then, registered nurse, cardiology unit, St. Patrick's Hospital, Melbourne, Victoria 3006. Fine. Yeah. Hifza Jailani. Hello, Hifza. Hello, Hifza. Oh, sorry. Unmute. Oh,
Hello, sir.
yeah, hello. So you got your corrections, no?
Yes, sir.
So one is it is lengthy. Try to limit to 180 to 200 words. And a lot of mistakes are there. Take care of those mistakes, okay?
Okay, sir.
Yeah. Okay, I'll send this letter to you.
Okay, sir.
Yes. Next. Any doubts you have, you can ask me. Otherwise, Sukhvinder. Sukhvinder.
Yes, sir.
Sukhvinder, any letters for correction? No. Speaking.
Yes, sir. Speaking. Yes.
Speaking. Are you ready?
Yes, sir. I'm ready.
So, okay, fine. Yes, you have the card with you, right?
Yes, sir. I have got.
Okay, right. Mhm.